During the call, any background noise and conversations that are not muted on your line may become part of the archive presentation and may prove distracting to other people. We would ask that you would mute your line. You can control this in the Zoom conference room using the mute feature located in the lower left-hand corner of the window. For this call, we are looking for interaction, and we welcome questions, comments, and clarifications at the end of each presentation. Please remember to unmute yourself when you want to talk. Due to the number of attendees and to help us track attendance, please put your name and organization in the chat box so that everyone knows who is here. If you're not able to connect by computer, if you're connecting by phone only, please email your name and organization to tmarkle@wisc.edu. That's TMARKLE at wisc.edu so that we can track your attendance. This presentation and accompanying materials will be available at a later date on the Health Transition website under the Learning Community tab. At the end of the call today, please complete the evaluation. You will find a link will be posted in the chat box as well as on your screen. If you leave the call early, the link will be sent to you as long as we know that you are on the call. We would especially we always appreciate future topics for Learning Community calls. We also hope that you received an agenda to help participate with the day. Today, we will be learning about and discussing transition support tools and practices. We're going to spend about 20 minutes discussing transition practices from our American Family Children's Health partners. We will, including an awesome PowToon video they've developed. We'll then move into a sneak preview of the Youth and Adult Transition Toolkit, and we'll close with some targeted information on the 2020 RFA, Advancing Family-Centered Care Coordination for Children and Youth with Special Healthcare Needs using a Shared Plan of Care. We will monitor the chat box throughout the presentation, so if you'd rather type your questions into the Zoom chat box, that is fine. Any questions not addressed during the presentations will be part of the Q&A at the end. With that, I would like to introduce Brittany Storhoff and possibly Kristen Sodergren. Kristen is a nurse practitioner with the Pediatric Complex Care Program at AFCH and project lead for their QI grant. Brittany is a nurse at AFCH and is a student in the doctoral program in nursing. They'll be talking about the workflow, their workflow, and how they implemented the Transition Readiness Assessments, as well as a pre and post education survey and sharing a PowToon video their team has created called Introduction to Youth to Adult Healthcare Transition. So welcome, Brittany and Kristen. I'm going to stop sharing my screen to allow you to share yours. Thanks so much for being on the call today.
Thanks, Tim. We're both here.
Yay!
Yay. I think Brittany, yes, okay. So Brittany's working on sharing the survey. I think just to start out with our transition workflow process, we have been working on identifying the kids in our program, the Pediatric Complex Care Program here at AFCH, who are 12 and older, given that we would like to begin the transition process at about 12 years of age with respect to education and sort of slowly preparing families for this time. So we have a care coordination assistant who goes through our list of upcoming patients on the schedule for the next 2 weeks. And she highlights the kids that are 12 and older and then sends actually all of us providers an email. And in addition, then we put them on our weekly agenda in our team meeting so that it's highlighted in our minds as to who we have coming up and where we need to go with education, as well as we can bring up any additional questions if other people have provided some initial discussion. At that time, we ensure that all of the kids have the transition checklist added to their problem list. And as we start introducing the education tool, which has been developed through our institution, some of that will transition to the education tool. But for right now, we have kind of both systems working in parallel. And it's that transition checklist within the problem list, we are then able to document topics that are covered. The nice thing about the education tool, which Leanne will speak about a little bit later, is it does have the materials that we can use to highlight specific topics based on age group. So we use that. And then in addition, the other component that we've pulled together is our after visit summary. We've added a dot phrase for those teenagers where we can customize some of that education and links for the families to have once they go home. So it's sort of a multi-level process of both identifying the patients with our care coordination assistant, highlighting them for the rest of us, adding that transition checklist to their problem list, and introducing the education tool, and then using the after visit summary as a way to help the families kind of follow along where they're at. And this is all incorporated in their shared plan of care that then gets mailed to them after the visit as well. So there's many different things that kind of go to it. And then with that, we developed a survey, which Brittany will talk a little bit about, to help assess readiness.
Yes, so the next step of our project here was to develop a survey that could be used not only as a transition readiness tool, but also to provide feedback and data for providers to assess the effectiveness of the education they were providing about transition throughout the visit. So this survey kind of went through several steps to format the final survey, and that was created with input from parent partners as well as providers on the team. So, you know, a rough draft was developed. It was trialed with families prior to implementing it with our population. So it was nice to be able to incorporate the feedback from families on this process. Sorry, I had something pop up there. So the way that we were able to effectively use this survey is it is given at the beginning and end of each scheduled clinic visit to all parents or guardians of patients aged 12 years and older. And we do this survey right at the beginning of the visit and right at the end to compare pre and post education and to compare how ready we feel these patients are to transition. So I have the survey pulled up here.
It's a Qualtrics survey, so we have a link on an iPad as well as we can pull the link up on a laptop, and families are able to pretty easily go through and do it. It takes just a couple of minutes.
So the pre-education questions are here, just starting with the basic, you know, how old is your child? And then the pre and post education questions are very similar, comparing the ready or how confident and the knowledge level of the parents regarding the transition process.
There's also some space at the end for, as a provider, for us to add any additional comments about how we feel that the family is doing or what place they're at within the whole readiness transition process, as there will be times in a routine follow-up visit, and these are only done in routine follow-up visits, not urgent care visits, where we may not have the opportunity or the family is like totally not there or in that place to talk about transition, so that we can just have that little comment to know, you know, where we need to follow up the next time.
So we started handing the survey or readiness assessment tool out at the beginning of October, and since then we've completed 15 surveys, and we are currently in the process of analyzing that data to assess the confidence and knowledge and readiness needs of parents and guardians. So more to come with that in the near future. Does anyone have any questions about the process?
Please remember, you may have to unmute yourself. And if you have joined the call a little bit later, we ask that you would, to help us track attendance, put your name and organization in the chat box. So any questions about the survey that they've been working on?
This is Anne. I'm just wondering, you said you had a couple of different ways of administering the survey. So how do you pull that together, and who does that?
Right, so the survey, it's all in Qualtrics. So it's either done on the iPad or in a laptop, and then that goes into, I will admit, like the magical database, and then Gemma, our research admin guru, can spit
Okay,
out
so
the
they're actually inputting into the same database essentially.
Yes. Yep.
Okay, got
Exactly.
it.
Yep.
Thanks.
It goes all into the same database. Yes. Yep. Which is helpful. And right now these are anonymous, although at the end we input the child's name just so that we aren't trying to duplicate things over and over and over again.
So how are you getting post if it's anonymous?
Well, it's all done in the same visit.
Oh,
I can scroll up here. So
okay, got it.
the pre-education questions are done prior to the visit, like while they're in the waiting area. And then it's the same survey that's continued at the end of the visit here. So then the post-education questions are asked. And the hope is that over time we can compare more and more data and more levels of understanding and confidence.
Great. Okay, thank you. For some reason, I just missed that in the scroll that those were connected.
Yep, so they are, it's kind of nice the way the survey is set up. When you get done with the first set of questions, the pre-education questions, it asks you to hand the device over to the provider, and then it holds you there, and then we hand it back to them at the end, and they can continue with the next set of questions, so that all of the data pre and post is linked to the same patient.
Wonderful, thanks.
Yeah. So then our plan for next year, we're reapplying next year so that we can, for this Youth to Adult Transition Grant, so that we can try and collect more survey data with the hope of seeing if there are trends and education gaps, and then maybe even tailoring it a little bit more to patients' individual patient needs. Like I said, right now it's generally anonymous because we want families to feel open, but we might be able to tweak it in ways that we can really tailor the education specifically to the families. And we wanted to add a question to the family as well in there. Is there areas or particular topics that they feel that they need more information on? Not just kind of the blocks that we've identified as transition steps throughout the years.
And there was one question in the chat box from, at what age do you start administering the survey?
We try and get starting about age 12. So early on. We get some panicked faces, but they're good at overcoming.
And there's another question in the chat box. Are there specific information that is shared with families at the visit, and what are those tools?
Yep, so part of the education tool that Leanne will talk about, we have links in there that discuss specific education, specific transition topics based on age. And that's what's all, we provide web links when appropriate onto their after visit summary. And it goes through anything from how to conduct, if appropriate, and with our patient population, not often, but if appropriate, we might be doing a visit with just the patient for part of the time, reviewing how to contact the office, but then also, the point at which we need to talk about guardianship, what their post-high school plans are. Are they going to be doing day programs? Are they continuing education through the school district to 21? How to switch insurance pieces and what all of that looks like. So those are all built into both the education tool, and then we have those additional resources that we add on to their after visit summary for them as well.
So for the provider's use, we've developed what we're calling the transition checklist. And basically under each age category, like 12 to 13, it lists the topics we should be discussing. Under ages 14, 15, it lists the topics we should be discussing, and so on and so forth.
Great, thank you. That's helpful.
Yeah, so I think the other piece if we're able to work with the grant next year would be to provide more patient-facing material. Right now, a lot of the material that we have is kind of cues for providers on what to talk about, but we'd like to develop and find and include more patient-facing material that can go into their shared plans of care and after visit summaries for them to have.
So another question from the chat box, are those links that you just talked about, are they available in the EMR, and will that be explained a little more fully when Leanne talks?
Yes, they are. Well, both. It'll probably be explained a little bit more with Leanne, and then because we've taken the links that are in that education tool and copied them and put them into our after visit summary. So that's how they live, for which that other providers can see if they look at their after visit summaries or the education tool or transition checklist as to what's been discussed and what they've received. I would say the other piece that we'd really like to start doing is interviewing some of our families that have gone through the transition process to find out what has been helpful for them, and where they feel there may have had knowledge deficits, so that we can kind of improve upon the process as we move forward.
So finally, as part of our grant requirements in 2019, the goal was to create some sort of education that could reach patients and families. And in order to reach as many people as possible, we decided to create a video about transition. So this first PowToons video is kind of an overview of the transition process. In future goals, we hope to create more videos that are a little bit more specific on the topics of transition. So we're going to share the video we've created for our families. Can everybody see this right now?
It should be just a blue screen at the moment.
It's looking good from my end.
Okay. Change can be confusing to navigate. For youth with medical complexity, transitioning to adult healthcare comes with many questions and concerns. Our program gives families a roadmap to navigate this experience. We will help you plan for this change and partner with you along the way. We hope you find this a helpful starting point. Have you ever thought about healthcare for when your child becomes an adult? No, what do you mean? Healthcare transition is the process of getting ready for healthcare as an adult. Think of it this way. As a child, the parents or guardians usually help with medical needs, like appointments, forms, and medication. But as children get older, some responsibilities may shift, and eventually they will meet adult providers and learn a new healthcare system. When does this process start? Starting around age 12, providers will begin to talk about this with their patients and families. This process is achieved through thoughtful planning and will be addressed little by little over the teenage years.
What kind of things will we talk about?
While this process may be different for each family, here are some of the things we will discuss. In the early teenage years, around age 12 or 13, we introduce transition, build relationships, and promote independence when possible, allowing for one-on-one time with the teen and provider when appropriate. We also discuss changes that occur with MyChart access. As the teen gets older, usually around age 14 or 15, we help your child understand their medical conditions, medications, and healthcare system, and promote participation in decision-making as appropriate. In the later teenage years, ages 16 to 17, we further discuss understanding the adult healthcare system, post-high school plans, and the legal implications of turning 18 years old. Eventually, around age 18, and continuing into adulthood, we review the transition checklist and goals, identify and meet adult providers, and create a transition care plan to help with this process. We also periodically assess readiness throughout the transition process. This helps ensure a smooth transition, similar to how we fuel our cars for the road ahead.
Wow, this is a lot of information. What can we be doing to help prepare?
Great question. The best thing you can do is regularly check in with your complex care team and ask questions about the process. We look forward to joining you on this journey. You can also get more information at gottransition.org. right. Does anyone have any questions or comments about the video?
Well, great.
Please remember, if you do, this is time for discussion. So unmute yourself and have discussions. We will keep track of the chat box as well.
There, this is Gita. I'm really curious. Thank you for sharing that video about when you shared this with youth and families, what kind of feedback that they have given you about the video.
Well, I will admit, we're just in the early process with the video. So there haven't been, our patient or family representatives have enjoyed the video. But we have not been able to roll it out yet to a large number of patients, as we were just finishing it.
Okay.
But the initial feedback we got from our parent partners was positive, and they liked the fact that it was just a quick, like 3-minute video that could outline a lot of topics.
We do have a question if the video is available. Are you planning on making this publicly available on YouTube or just internally through UW Health?
I think eventually, yes, it will probably be available on YouTube. We did make it pretty specific to our patient population, and we have not gone through branding through UW Health yet, so I wouldn't say that it's kind of
Public
at this point, but
Not ready for prime time yet.
not ready
Yes.
for total prime time yet.
No, but I know that I'm working with them to try to figure out how they did this PowToon thing, to see if maybe we can have a more generic one that's associated with the Youth Health Transition website.
Mhm.
So hopefully I'll be able to learn the secrets of PowTooning and get something, because I really do like the concept, and it's a lot easier. I find myself enjoying it a lot more than listening to myself talk about youth health transition.
Mhm.
Well, and the nice thing we were hoping at least is to be able to then use this as a stepping stone to create some shorter videos that specifically address those topics that were outlined in each of the age groupings, so that then if people feel that they learn better visually or hearing things, then this is an option.
And the hope to share this with our families is to have it available on the iPad that we're also providing the readiness tool on. So if they have a few minutes before their appointments, they could watch the video then, and then also providing the link on their after visit summary, so it's something that they could go back to and watch at home as well.
Awesome. And then also eventually, hopefully, running through any of the TV screens that are available in AFCH.
Mm-hmm.
Yes, it'll
that
be
are-
on all screens throughout the hospital. We can't get away from it.
Absolutely. Any other questions? And anything else that you guys would like to add about the transition readiness assessments?
I think that assessments are going to be extremely helpful as we get more and more data, so that we are able to refine the discussion for the families into topics that are pertinent both individually and as a group, and kind of see where our knowledge deficits are as well. So looking forward to more data and more to come.
Yep. And I know from working with the team that trying to decide on what questions to include, not making it too long, but yet getting information is always a hard discussion. So thank you for doing that work, and hopefully we'll be able to continue on next year and see what sort of results we might have that could help other groups out. Any other questions about the PowToon Transition Readiness Assessment or the pre and post survey that they're working on?
So this is great. This is Sharon. I just encourage you also to maybe share this with the other complex medical teams. And I don't know if they're on the call today from Children's, and I think Marshfield is also joining into provision of care for complex care through their programming, their complex care program. So I think people would be really interested in seeing this video as it evolves. So if they're not on the call, reach out to them and share that.
For sure.
Yeah, definitely.
If there aren't any further questions, then we will close this part of our presentation. I will stop sharing my screen and introduce you to Leanne Marso. Leanne is a nurse and is the AFCH Ambulatory Operations Director and co-chair of the Youth to Adults Transition Steering Committee. Leanne is here to give us a sneak preview of a very new developed and in development Youth to Adult Transitions Toolkit. So Leanne, feel free to share your screen. And if you need help, I know Brittany's close by and can give you a hand. And we'll see oh, that looks good. I could see the toolkit. Thank you so much, Leanne, for being here.
You today. So as Tim said, my name is Leanne Marso. I'm the director for AFCH Ambulatory Operations here at the American Family Children's Hospital. And I am working with a group of talented individuals throughout our organization, particularly in our PEDS specialty areas, on implementation of our Youth to Adult Transitions guideline that was developed a couple of years ago and put in place for our organization, pulling from a variety of national standards. And so there was a group of us, just giving you a little bit of background prior leading up to this toolkit. So a group of us came together to figure out how we want to best implement the transition different components of the transitions guideline for our organization. And of that, it's been a long journey and different iterations of ways to try to streamline workflows. And as Kristen and Brittany had shared, we've utilized different components within our EPIC electronic medical record to try to figure out how best to document communication that's happening with our patients and families so that others throughout our organization can easily see the information and add to it to help support transitions of these patients from youth to adult. And so we've, as you can imagine, trying to build anything electronic takes a little bit of a village to make things happen, especially in an electronic medical record, just with all the heavy lift that can be involved. And so we started out with one workflow that Kristen referenced, where we had a link through our problem list in the electronic medical record that would take you to a checklist that providers could use to guide their conversation with patients at different age ranges. We since then found a tool that is within our organization is primarily used on the inpatient side of things. It's called an education activity that was introduced to our ambulatory TR steering committee as one way that we might be able to improve utilization of the transitions teaching materials and checklists, because it's a little bit easier to access and navigate. So we had to do a little bit of building with that. And on your screen now is an education sheet that we use within our organization to try to show folks how to access this information. But the reason I wanted to share it, if you bear with me, I'll get down to this screen here. This is a little bit more of what Kristen and Brittany were referencing with how the education activity within our EPIC HealthLink system looks, where you have down the left-hand side of the screen, you would have your different topics that you would want to cover, or at least start to cover during the different visits, particular to an age range. And then in the middle where it says discharge planning on this, this is not specific to the education activity, but it would say the education activity, and it would have the different topics and maybe some tips and tricks or certain verbiage that providers could use in introducing that specific topic. And then it gives you ways to document who you spoke with and what the outcome was. And then on the far right-hand side in this part of the education tool is a cell for patient handouts. And these are things that you can quickly link to and pull up, but also print off to give to the family. So it was a nice way to both have the topic and your associated resources all in one area, so you weren't having to click through several different screens within your computer to try to get the family and patient the information that they needed. So this was one thing that we worked on within our committee. But through that and through our work of the steering committee in trying to talk about how we want to introduce transitions and what information is already out there, we realized that we had a multitude of resources in a variety of different locations, and trying to find those and remember what they were called and where you find them it can be challenging, and oftentimes folks might just give up. Or as Tim and I were talking a little bit earlier, you think you found the right thing, you start in on it only to find out at the very end that it's not the piece of information you were looking for. So we, what you see on your screen right now is our hospital intranet. So this is provider facing, not something for patient facing or public facing, but this is a screen from our UConnect intranet that shows one spot that we can go to, and we developed, based on some previous toolkits that were developed, a Youth to Adult Transitions Toolkit. And this is one thing that we thought might be helpful for staff and providers as they try to engage in conversations to prepare families for transitions in whatever their role. So we looked at some of the different toolkits. As you can see, they're down the left-hand side of the screen for different specific topics. We looked at those as reference and pulled a small work group together to develop what are some of the topics we would like to include and how do we want to, quote, bucket them. And then what are some resources that might go into each of those buckets. So on your screen right now, you can see we thought it might be helpful to have something for finding adult providers. As we all know, that can sometimes be daunting and challenging, and where do you direct families? And some of this is driven by insurance, but other times it's nice to have some resources of where they might start. So if we, for our internal providers, they can click on that topic and they'll see we have a welcome center that we can refer patients to, and they will help get them connected within the system to adult provider counterparts. We also thought it would be helpful to have a spot where you can find all of the references. And as Tim said, this is still in development. We're constantly tweaking it and adding information as we find out what other additional resources folks are using. But this is another spot where we might put our, what we call health facts for you, or the HFFYs, the HFFYs, and other information that providers may find helpful in communicating with families. We thought another spot might be nice to have forums that are pertinent to transitions, especially as patients and families, or patients get particularly near that 17-18 range and need to start thinking of power of attorneys, guardianship, or if they can and appropriate, giving the authorization to communicate with parents, because we still know some of these patients go off to college and need assistance, or still have family listed as contact information. So that's another one that we have developed and are constantly adding different forms to. We have the guidelines and policies that take you to the Youth to Transitions guideline. And then we put a bucket in here for related toolkits of where we might want to embed transitions information, that if providers are going to a health maintenance or well-child toolkit, they might want to link back out to the transitions toolkit so that we can make it really interchangeable and different paths that you can lead to one and the other. We also are hoping to develop a bucket that will lead to outside resources such as the GOT Transitions and other reference information that would be helpful in preparing families for transitions. We also are looking at that sheet I showed you about the education instructions on how to activate the activity. We want to put that in there. So there's constant buckets and that we're developing. And as we share this with other different specialties, we're learning of their specific reference materials that they've developed for their particular specialty, and would envision that we would have buckets maybe for endocrinology or diabetes or nephrology as we find out some of those information, and can put that here so that others that are maybe seeing the same patients might know what the different specialties are referencing as they discuss transitions, and maybe use it as a launching pad to develop some additional information for their patient population. So with that, I can answer any questions that anyone might have related to the toolkit or our education activity.
Please remember to unmute if you'd like to share. We will also keep track in the chat box. Any questions for Leanne or comments?
Leanne, it's Ann Harris. What's under guidelines and policies? I don't know. I don't know if you can show that, or if there's nothing there yet, or just curious what you're referencing.
Yep, no, that's a great question. And in here, you'll see on the right is this transitions of care pediatric that's our guideline that was put out through our organization that kind of sparked the work. I pause on clicking on it because it's not working quite correctly right now. I just emailed our contact to have him update it because you can't easily back out of it. So, but that's the link to the guidelines. So if anybody wants to see what the full multi-page document is with all the references that drove decisions and how to start those discussions, or what we want to have happen within our organization for transitions, that's in there. We also have, you can see there's the consent to treatment. We have this in other buckets, and our thinking as we pulled together the work group to develop the toolkit was that there may be forms and references and guidelines or policies that sit in multiple locations, because you might want to see this minor's consent for treatment here in the policy because it has additional information that might guide what you can do, but then there's authorization form that might fall into the forms bucket. So you might find things in multiple buckets, but that way it's a little bit more user-friendly and interactive, so that you can find stuff in various locations, but still all on this one landing page.
Well, that makes a lot of sense. Thank you.
Absolutely.
And from the chat box, Leanne, we have a question. Is this visible only to peds, or can adult providers see this too?
Adult providers can see this too. It's throughout our organization.
Okay.
So the nice thing is, as we transition, if they are wondering or families reference, they can easily find this page as well.
Cool. There was also a suggestion, which I know that we've talked about, adding supported decision-making information, and some more of the legal transition issues to make sure everybody's on the same page.
Absolutely.
And then a question of what happens when a person goes to the Finding Adult Providers Welcome Center. How does the Welcome Center help? Do you know how the Welcome Center helps find adult providers?
That's a great question. I don't know the intimate details of how they connect to families, what kind of intake they do, but they do serve as a central resource.
Right.
Pardon me?
That's why this is in process too. I know we're not satisfied with that as the only resource.
Right, absolutely. There is definitely, and that is one that is within our organization. So we would like to add some other external, but still a reference for our internal providers. This Welcome Center is really UW Health focused. So obviously there are patients and families that may be transitioning outside of our organization or to other areas that we would like to at least help provide some additional guidance for how where you might start that navigation to find an adult provider.
And I know as part of the steering team, the transition type steering team, that you are working on trying to educate adult providers as well as pediatricians about transition.
Yes.
Do you have specific things that you're doing to educate adult providers be ready to accept children with special health care needs?
We have been engaging more of our adult, particularly our adult primary care colleagues initially, and reaching out to our specialty care colleagues to try to engage them more in the development of this, to see and get their feedback on the information that we are developing and the conversations we are having, what is helpful to them. because as part of the transition packet that we look at doing is there's the checklist, but part of the checklist is to develop a summary letter towards the end of the patient's time in pediatrics to summarize their care and hit the high points. Now and so we've developed a template for that letter that providers can use to hit some highlights. We realize that it doesn't cover everything, but it gives an opportunity of here are the big pertinent items that we see that we want to make you aware of. And so we're working with our adult colleagues on what is it that they would like to see and what is it that they'd like to find, what they would like to see or find helpful.
Thank you. Any other questions for Leanne at this point? Okay, then finally, I would like to introduce the director of the Youth Health Transition Initiative, Ann Harris, who's going to provide some important information on the possibility of choosing a transition focus area as part of the 2020 SPoC QI grant. Ann?
Okay, so I know that a lot of people on this call already do know about the the new opportunity for shared plan of care grants, but I'm going to pull up the guidance and trying to do that right now. I think it's here, but it's on the wrong page. Let's try that. So this is the first page, and if you need a link to this, we can make sure that you get it. It's through the Wisconsin Medical Home Initiative and at Children's Health Alliance of Wisconsin. But
and just really quick, the links and more information are available on the Youth Health Transition website.
Right, and I was gonna, I'll also refer to the medical home website as well. So yes. One way or another, we will get you the information if you haven't seen this grant guidance. But this is the year. There's been multiple years of offering quality improvement mini grants to practices to focus on the shared plan of care, which is the main focus for this grant, and in conjunction to work with transition-aged youth and their families to promote and develop and promote best practices in transition of care, which is part of, you heard one of the grantees earlier with Kristen and Brittany's presentation, and we're just highlighting what's a little bit different about this year's quality improvement grant guidance and the opportunity. So this year, again, the main focus is shared plan of care, and I'm not going to go through every page of this, but I'm going to scroll down or I'll relocate to the optional add-on for youth health transition. So this year, it's great to be able to announce that we have some additional funding, thank you Sharon and others, for focusing on this age population, youth between the ages of 12 and 21 years of age, to do the additional transition work. So in addition to the shared plan of care work, there are, if you're choosing a population of youth with any type of diagnosis or special need, to look at transition, adding transition activities to the shared plan of care work. And there's 4 specific add-ons which the supplemental funding is designed to support. I know some current teams have chosen this as a focus this year without additional support, but this year we're hoping to even do more and better work, and it's hard to know how you could do more and better than what we've just heard presented, but to continue that work, there's 4 asks, and then again at the bottom of the screen, if you can see this, we are encouraging returning or experienced teams to apply for this, or if you've had a grant in the past and want to refocus again and do some additional work on transition or through the shared plan of care, that's also fine. So new or returning grantees are welcome to apply for this. So the 4 asks are these 4 bullets. One is to do a team assessment of your practices pre and post assessment of healthcare transition activities. And the link here is to the GOT Transitions tool for practice assessment. So that's been a part of our way of measuring what impact some of this quality improvement work has done, as well as giving teams a chance to see where they start and maybe identify areas that they can work on during the year. So we do that in January and again in December of the Quality Improvement Grant year, which is 2020 coming up. Then we also have this issue of completing a youth readiness assessment, and you saw an example from Kristen and Brittany at AFCH about what they're doing with their complex care youth and families, and you can use some of the tools that have already been developed or use those as a taking off point to develop your own tools. But we do have resources through the Youth Health Transition Initiative and some of our partners to help you do that. The third requirement or ask, if you will, is to collaborate with the Regional Center for Children and Youth with Special Needs in your area to complete some kind of a training or information sharing with families. We do have a Build Your Bridge curriculum that's designed to be done in a 90-minute workshop for families. We have had a lot of positive feedback when families do attend. Our challenge has been for the grantee teams in the last few years getting their families together to attend. And one of our other current 2019 QI grantees at CHW with their complex care team wasn't able to be on this call, but shared that they've offered several types of family trainings in this year and had some limited participation and positive feedback again when they are able to participate. But we're looking at how to best reach families, and it may not be in sort of one place, one time. There may be ways we could do asynchronous learning or have some web-based type experiences. So the Youth Health Transition Initiative is really here to provide support and help figure out what's the best way to provide this education, either using a currently developed tool or other activities, and then collaborate with the local regional center to provide that education. So this third bullet is really not just, I hesitate to say it's a requirement, but we really need to figure out how families will get the information that they need to help them to develop a plan or to get to the next step in that transition process. And then the fourth bullet here is the type of call that you're participating in today, which is one of our Youth Health Transition Learning Community calls. We already have the dates set out for those for next year. So those are the four asks that come along with the additional $5,000 supplement for this year's grant application, and those are due December 2nd. And again, we're happy to provide technical assistance in making your plan or helping you complete an application. And we're hoping that your people are interested in doing that. There's a lot more in this grant guidance, which including the dates for all of the project activities and expectations and some examples of shared plan of care, et cetera. But I just wanted to highlight in particular that the supplemental funding for the focus on youth health transition. So if there are any questions, I don't know if Gita's still on the call. I can stop sharing my screen, or we can just go back to a discussion if anybody has questions about this.
Yes, and it does look, thank you so much, Ann, and it does look like we do still have some representatives from the Wisconsin Medical Home Initiative, the bearers of the grant. So any questions about the grant itself, applying for the grant, or the supplemental at this time? Okay, not hearing any. We will go ahead, and at this point, I believe we have completed our goals for this learning community, and we would encourage all current teams to apply and just continue to spread the word. As I tell my friends down here in the southern region, is I love my UW Health teams and my teammates, but I'd really like to meet some people from other clinics as well. So hopefully we'll be able to spread the word and start to work further throughout Wisconsin. And I thank you so much for each of your help in doing that. We would ask that you complete the evaluation. The link is on the screen, as well as provided in the chat box. We always like to have feedback, and this helps us determine what is useful. and what is helpful for people, for our healthcare transition champions like you. Our next call will be Thursday, March 19th in 2020. We hope you'll be able to join us. Details of that call will be posted on our Learning Community page of the Youth Health Transition website. We thank you so much for your participation. This concludes our presentation. Have a fantastic rest of your afternoon.